This video we are going to learn about drugs called cholinergic and anticholinergic drugs. We will understand how this kind of drugs act in our body. So first of all we have to understand that for this cholinergic and anticholinergic system, the chemical called acetylcholine is exactly involved, that is represented by ACH. And in this video we will go through its synthesis, the synthesis of ACH, its storage and its receptors. We can call it as a cholinereceptors where it is present in our body. Then we will understand drug classification, their action and application, and we will also go through anticholinesterases which are present in neuron. Okay, so let us go one by one. So ACH is a major neurohumoral transmitter including in ANS and CNS. ACH is a major neurohumoral transmitter chemical which transmit the signal from one neuron to another neuron. ACH is synthesized locally in cholinergic nerve endings and stored inside nerve vesicles. So it is synthesized locally in cholinergic nerve ending and stored inside the nerve vesicles. Okay, so let us understand the pathway through which it gets synthesized. In the presence of acetate and choline, when they combine together, and the enzyme called choline acetyl transferase which acts in these two compounds to produce a chemical called acetylcholine. Acetate plus choline produces acetylcholine which get stored in these small bubbles, blue bubbles, which are shown in this picture. That is a kind we can consider as a nerve vesicles in the neuron where it gets stored, and once it performs its action in our body, then second enzyme comes into play, that is cholinesterase enzyme, which breaks down this acetylcholine into again its precursor form, that is acetate plus choline. So this is how we have understand its synthesis and its storage and how it again get break down into its simplified form. Now let us understand their receptors, which we call it as a cholinereceptors. Actually there are two kinds of receptor. These cholinereceptors are further classified as two classes, that is muscarinic receptor, the first class, let's write it down, muscarinic receptor, and second one is nicotinic receptor. Again this muscarinic receptor classified as M1 receptor, then M2 receptor, and the third one is M3 receptor. Similarly, this nicotinic receptor classified as NM receptor, where M represent muscle, skeletal muscle, actually it is present in skeletal muscle, and NN where small n represents neuron, ganglia we can say. So through this picture let us understand the location of each of these kind of receptors. So to make it more simplified, we can understand this like that. M1 receptor is present at the upper part of our body, that is in our brain we can say. M2 is present in heart, M3 in smooth muscles like urinary bladder, bronchi, intestine. M1 that is present in different glands we can say, which secrete different chemicals. NM receptor that is present in skeletal muscle, we have discussed already, and this NN receptor present in this ganglia, autonomic ganglia, that is also in brain we can consider. So whatever the action we will get which mimics the action of this acetylcholine, that we call it as parasympathomimetic action. Yes, there are abundance of different kinds of muscarinic receptor in eye, but abundance is of M3 receptor in eye, and as we discussed, M1 receptor is present in glands, and whatever the effects we will get which are totally opposite to that of acetylcholine, that will come under parasympatholytic action. Okay, so we have discussed synthesis, storage and receptors. Now let us understand the drugs, cholinergic drugs, which acts as sympathomimetic as that of cholinergic, we can say acetylcholinergic action. So classification we have to go through it. Classification of drugs, there are actually two classes. First class is choline esters. Example is plain simplified form acetylcholine. Next, little bit modified, that is methacholine, carbachol, methanicol. Second class is alkaloids. Example is muscarine and pilocarpine. Okay, only two classes are there, cholinester's and alkaloids. Let's understand action of these drugs now. We have gone through classification. Now let's understand the action of this drug. As we have discussed that these cholinereceptors are present in different parts of our body. It has spread across our body in different kinds, like in heart, in blood vessel, in smooth muscle, that is also present in glands and also in eyes. Okay, so we had mentioned this as upper part, lower part and middle part. Heart is present in middle part, so M2 receptor will be there. In eyes, abundance will be of M3 receptor. There are M1, M2, M3, all those things, but M3 is in higher quantity. In glands, M1 receptor, blood vessel, M3 receptor, smooth muscle, intestine, bronchi, all those things, M3 receptor. So in heart, it will cause bradycardia, that is decrease in blood pressure. So how it decreases the blood pressure? In blood vessel, it dilates it. It dilates blood vessels, due to which there will be bradycardia. In smooth muscle, it will cause constriction of smooth muscle. Okay, like bladder constriction, bronchial constriction, asthmatic like condition. And in glands also, it will cause that gland to constrict, to secrete, like sweating, salivation and gastric secretion will be there. Secretion will increase. And in eye, it will cause constriction of eye to cause meiosis action, meiotic action. This is all about muscarinic action we have discussed. Now let us go through this nicotinic action, where NM and NN receptor are actually involved. So through NM receptor, we know that the skeletal muscle actually comes into play, and in this NN receptor, neuron comes, that is autonomic ganglia. So in skeletal muscle, parasympathomimetic action will be like contraction of skeletal muscle. And in this autonomic ganglia, what does it will do? To counter sympathetic action. It will counter the sympathetic action, means it will bring sympathomimetic action by acting on this different different neurons, autonomic ganglia. So this we can consider as our body, which we had divided into three parts. Now let us understand anticholinergic drug. So what is this anticholinergic? These are agents that inhibit cholinesterase and protects acetylcholine from its hydrolysis. So we can consider, we can say that it increases the level of acetylcholine by inhibiting this hydrolyzing enzyme called cholinesterase. So in Alzheimer's disease, what exactly happens? As we all know, that is a kind of neurodegenerative disease where there will be a decline in cholinergic neurons. As cholinergic neuron declines, their number reduces, neurotransmission signal will get failed. There will be a problem in the signal transmission from one neuron to another neuron. So in this case, if we use this anticholinesterase drug, it will increase the availability of acetylcholine. Okay, despite there is a less cholinergic neuron, but acetylcholine level will get balanced in brain. But for that, the drug which we are using, it has to be highly lipophilic, because it has to cross BBB, which we call it as a blood-brain barrier. And drugs which are used for this Alzheimer's disease or as anticholinesterases are like physostigmine, neostigmine, rivastigmine, donepezil. And one more class is there, that is tacrine class. Example is memantine, which acts in neuron and increases the level of acetylcholine. The presence of acetylcholine will get increased, which will help to transmit the signal from neuron to neuron. And now the last part of this is application of cholinergic drugs. We know that it is present in eyes, abundance is of M3 receptor, so it is act as miotic. In glaucoma, it increase tone of ciliary muscle. Example is pilocarpine. So most often the dosage form whichever is available in the market, it contains pilocarpine. Next is myasthenia gravis. that is a kind of skeletal muscle disorder. So through NM receptor, this drug help to improve the muscle contraction by allowing ACH release and act on receptors. So what this drug do, it improves the skeletal muscle contraction in myasthenia gravis. Example is neostigmine. Third, it helps to prevent urinary retention through M3 receptor. It causes constriction of urinary bladder, bronchi, all those things. So due to which we can prevent the urinary retention in our body. Example is neostigmine drug again. Fourth class is post-operative decarceration. Example is neostigmine. To reverse muscle paralysis. To reverse the muscle paralysis, we use this drug. Then in cobra bite, through M3 receptor to prevent respiratory paralysis, because it acts in bronchi as well. Sixth, we have already discussed in Alzheimer's disease, it blocks this acetylcholinesterase action to increase the level of acetylcholine. Means it acts as anticholinesterase and helps to transmit the signal from neuron to neuron by increasing the level of acetylcholine. Meiotic myasthenia gravis, urinary bladder. So next class of drug, that is anticholinergic drug, that is totally opposite action as that of cholinergic drugs. So we can say parasympatholytic action. Lytic means opposite. And so let's consider its classification. There are three classifications. First one is natural alkaloids like atropine, scopolamine. Second is semi-synthetic derivatives like homotropin, ipratropium and tiotropium bromide. Tiotropium bromide. And third and last class is synthetic compounds like cyclopentolate and tropicamide. There it was 2 classes, here it is 3 classes. Cholinergic drug, anticholinergic drug. So let's understand the action of these anticholinergic drugs. Just keep in mind that the action whichever we have discussed previously, here the action will be totally opposite because the site of action, the receptor is same, but the action is antagonizing. That is why it is anticholinergic. So in heart, blood vessel, smooth muscle, glands, eyes, it will be totally opposite action. In heart, we know M2 receptor is there. In eyes, abundance is of M3 receptor. In glands, it is M1 receptor. In blood vessel, it is, let's write it down, M3 receptor. And then smooth muscle, again M3 receptor. So there it was bradycardia, here it will cause tachycardia, that is increase in blood pressure. And how it will increase the blood pressure? Yes, through constriction of blood vessels. Next, it will cause relaxation of smooth muscle like urinary bladder, bronchi. And in glands, it will cause reduction in secretion like sweating, salivation and gastric secretion will reduce. And in eye, there it was meiosis, so here it will cause mydriasis. So topical atropine is generally used to cause this mydriatic action, which helps for abolition of light reflux. For abolition of light reflux, atropine is used as mydriatic. So we have discussed this muscarinic action. Now let us go through nicotinic action, where skeletal muscle and autonomic ganglia involved. So there it was contraction of skeletal muscle. So through NM receptor, certainly here will be opposite action, that will be skeletal muscle relaxation, correct. And in autonomic ganglia, through NM receptor, it will counter parasympathetic action, means it will bring parasympatholytic action by countering the parasympathomimetic action. Okay. This is the body, M1, M2, M3. We can divide through 3 parts: skeletal muscle, autonomic ganglia, present in neuron. Now, okay, this tachycardia caused due to M2 receptor, then this blood vessel contraction. Okay, the last part of this video, the application of anticholinergic drug. as midriatic, there it was meiotic, so it will be midriatic through M3 receptor. It dilates the pupil, for example homotropin. Second, it acts as antispasmodic because it causes relaxation of smooth muscle, for example intestinal smooth muscle, renal smooth muscle, and abdominal cramp to relieve urinary frequency through M3 receptor. All those things occur, so it relaxes all these smooth muscles. Example of drug is oxybutylene, fluvoxate. It is also used in asthma. Actually, in bronchi, it reduces bronchial secretion and increases bronchodilation. Okay. Next is motion sickness and anti-secretory because it reduces the secretion, gastric secretion, salivation. Example is hyoscine. And fifth one is it antagonizes muscarinic effects of drugs or poison. So to antagonize the muscarinic effect of any drug or any poison, so it antagonizes the action of drugs, muscarinic drugs, bringing opposite action. Alright, so thank you for watching this video. In the next video we will make different videos on simplified notes. Thank you so much.